What if I told you that one simple morning ritual done in just 15 minutes could eliminate the chest tightness, breathlessness, and suffocating feeling that makes every morning miserable, and that thousands of seniors swear this ritual literally saved their breathing and gave them back their lives? Right now, millions of people over 60 wake up every morning feeling like there's a band around their chest, struggling to take a full breath, spending the first hour in distress before they can breathe somewhat normally. Meanwhile, those who discovered this morning ritual are waking up, performing these specific steps in sequence, and within 15 minutes experiencing complete relief from chest tightness and breathing comfort that lasts throughout the day. This isn't a medication, supplement, or expensive treatment. This is a strategic sequence of simple actions done in a specific order that addresses every factor causing morning chest tightness and breathlessness. Morning is the most critical time for respiratory health because what you do in that first hour determines how your lungs will function for the entire day ahead. Get the morning right with this ritual, and breathing stays comfortable all day. Ignore the morning and struggle through improper clearing and inadequate opening of airways, and you'll fight breathlessness from dawn to dusk. In the next few minutes, I'm going to reveal this complete morning ritual that seniors swear saved their breathing. I'll explain exactly what to do, in what order, and why each step is essential for eliminating chest tightness and restoring comfortable breathing. I'll show you the science behind why this specific sequence works when individual actions don't. And I'll share the powerful testimonials of people who were suffering every morning until they discovered this ritual and experienced transformation within days. Your mornings could change from struggle to ease starting tomorrow if you know this ritual and commit to doing it every single day. If you wake up every morning feeling chest tightness that makes you anxious and breathless, you understand how this affects your entire day and life. Maybe you wake up feeling like there's a weight on your chest preventing deep breathing. Perhaps you feel like your airways are constricted, like breathing through a narrow straw. You might experience actual pain or discomfort with breathing that makes you afraid something serious is happening. This morning chest tightness is one of the most frightening and limiting symptoms seniors experience, yet most people don't know what to do about it beyond waiting for it to gradually ease over an hour or more. Here's what's actually happening when you wake up with chest tightness. During the 8 hours you were sleeping, several processes occurred that affect your morning breathing. Mucus accumulated in your airways, particularly in your lower lungs where it settled due to gravity and lack of clearance. Your airways became somewhat constricted due to inactivity and the normal circadian rhythm of airway tone, which is tightest in early morning. Inflammation in your respiratory tissues increased overnight. Your breathing muscles, particularly your diaphragm, are stiff from being relatively inactive during sleep. Your body is somewhat dehydrated after hours without fluid intake. All of these factors combine to create the morning chest tightness and breathlessness that feels so frightening. Your airways are constricted, full of mucus, inflamed, and your breathing muscles are not functioning optimally. No wonder you can't breathe comfortably. Most people address these problems incompletely or in the wrong order. They might try to cough without first loosening the mucus. They might drink water but not address the airway constriction. They might try to take medications but not physically clear the accumulated debris. These incomplete approaches provide minimal relief. The morning ritual I'm about to teach you addresses every single factor causing your chest tightness in the optimal sequence for maximum relief. Each step prepares your respiratory system for the next step, creating a cascade of opening, clearing, hydrating, and strengthening that transforms your breathing within 15 minutes. The thousands of seniors who practice this ritual daily describe it as life-changing, the difference between dreading mornings and actually feeling good when they wake up. Let me reveal the complete morning ritual step by step, explaining what each component does and why the sequence matters. Step 1 is immediate hydration upon waking, before doing anything else. Keep a glass of warm water with lemon by your bedside. The moment you wake up, before even getting out of bed, drink 8 to 12 ounces of this warm lemon water slowly. This does several critical things. It provides immediate hydration to tissues that are dehydrated after 8 hours without fluid. The warmth helps relax airways that are constricted. The lemon provides vitamin C and compounds that help thin mucus. This hydration prepares your entire system for the clearing work ahead. The reason this must be first is that all the subsequent steps work better when you're properly hydrated. Trying to clear mucus when dehydrated is like trying to clean dried cement. Hydration turns that thick, sticky mucus into something that can actually be moved and expelled. Step 2 is steam inhalation for 5 minutes. Immediately after drinking your warm lemon water, boil water and pour it into a large bowl. Add a few drops of eucalyptus oil if you have it, though plain steam works too. Drape a towel over your head, lean over the bowl creating a steam tent, and breathe the warm, moist air deeply for 5 minutes. This step further thins mucus, soothes inflamed airways, opens constricted passages, and provides moisture to dry respiratory tissues. The reason this comes second is that the hydration from step 1 prepares your mucus to respond to the steam. The steam completes the mucus thinning process, making the clearing work in the next steps dramatically more effective. Step 3 is postural drainage for 5 minutes in strategic positions. After steam inhalation, use gravity to help drain the now thinned mucus from different areas of your lungs. Lie on your left side with your hips elevated on pillows for 90 seconds, allowing mucus to drain from your right lung. Switch to your right side with elevated hips for 90 seconds to drain your left lung. Then lie face down with pillows under your hips for 2 minutes to drain both lower lobes. These positions use gravity to move mucus toward your larger airways where you can cough it out. The reason this comes third is that steps 1 and 2 have prepared the mucus to actually move. If you try postural drainage with thick, sticky mucus, it won't move effectively. After hydration and steam, the mucus is thin enough that gravity can work. Step 4 is controlled coughing to expel mobilized mucus. After postural drainage has moved mucus into position, sit up straight and perform controlled coughing. Take a deep breath in, hold for 2 seconds, then cough twice forcefully with your mouth open. The first cough loosens mucus, the second expels it. Do this sequence 5 to 7 times, bringing up and spitting out the mucus that's been mobilized by the previous steps. The reason this comes fourth is that you need mucus in position before coughing is effective. Random coughing throughout the day barely moves mucus that's stuck deep in airways. This controlled coughing after the previous 3 steps clears mucus efficiently because it's been thinned and positioned optimally. Step 5 is breathing exercises to open airways and strengthen respiratory muscles for 3 minutes. After clearing mucus, do diaphragmatic breathing exercises. Sit comfortably, place one hand on your chest and one on your belly. Breathe in slowly through your nose for 4 seconds, making your belly expand while your chest stays relatively still. Hold for 2 seconds. Exhale slowly through pursed lips for 6 seconds. Do this for 3 minutes, about 15 complete breath cycles. The reason this comes fifth is that your airways are now clear, allowing maximum benefit from deep breathing exercises. These exercises further open constricted airways, activate and strengthen your diaphragm, establish efficient breathing patterns for the day, and calm your nervous system, which often becomes activated by morning breathing difficulties. Step 6 is light movement to complete the opening process for 2 minutes. Stand up and do gentle arm circles, shoulder rolls, and torso twists. These movements further expand your chest cavity, stretch respiratory muscles, promote circulation, and complete the physical opening of your breathing apparatus. The reason this comes last is that movement is most effective and comfortable after airways are clear and breathing muscles are activated. Moving with congested lungs is uncomfortable and inefficient. Moving after the clearing and opening work completes the transformation. The entire sequence takes about 15 minutes total. Hydration 1 minute, steam 5 minutes, postural drainage 5 minutes, controlled coughing 1 minute, breathing exercises 3 minutes, movement 2 minutes. 15 minutes that can transform your morning from suffocating struggle to comfortable breathing. The consequences of not doing this ritual are continued morning suffering and breathing difficulty that takes hours to partially resolve on its own. You start every day from behind, with compromised breathing that limits everything you want to do. This ritual gives you a fresh start every morning with clear, open airways and comfortable breathing. Now let me give you practical guidance for implementing this morning ritual for maximum effectiveness and making it sustainable as a daily practice. Preparation is key to consistency. Set up everything you need the night before. Fill your bedside glass with warm water and add lemon juice so it's ready when you wake. Have your bowl for steam ready in the bathroom with eucalyptus oil nearby if using. Have extra pillows accessible for postural drainage positioning. Eliminate any barriers that might prevent you from doing the ritual. Create a ritual mindset. This isn't a chore or a medical treatment. This is your gift to yourself, 15 minutes of self-care that makes the entire day better. Many people find it helpful to think of this as sacred time, non-negotiable and valuable. Setting this mindset makes consistency easier. Track your results to stay motivated. Note how you feel before the ritual and 15 minutes after. Rate your chest tightness and breathing comfort on a scale of 1 to 10. Track this daily for at least 2 weeks. The objective improvement you document provides powerful motivation to continue. Adjust timing as needed for your schedule. While first thing upon waking is ideal, some people need to modify slightly. If you need to use the bathroom immediately upon waking, do that first, then begin the ritual. The key is doing it before you get caught up in other morning activities. Let me tell you about Harold, a 74-year-old man who had been waking up with severe chest tightness every morning for 6 years. He described it as feeling like someone was sitting on his chest, preventing him from taking a full breath. He would lie in bed after waking, feeling panicked and suffocated, taking shallow rapid breaths that never satisfied. It would take 2 to 3 hours before he could breathe somewhat normally, and even then he never felt completely comfortable all day. Harold had seen multiple doctors, tried various medications, used inhalers, but nothing provided significant relief from his morning symptoms. He was becoming depressed because mornings were so miserable and he lived in constant fear of the breathlessness. Then Harold's daughter found an article about this morning ritual online and urged him to try it. Harold was skeptical that a simple routine could help when medications hadn't, but he had nothing to lose. Harold's daughter helped him set up everything he needed. They put warm lemon water by his bed. They bought a bowl for steaming. They arranged pillows for positioning. The next morning, Harold began the ritual as soon as he woke up. He drank the warm lemon water slowly. He did the steam inhalation for 5 minutes. He positioned himself for postural drainage. He performed controlled coughing and was amazed at how much mucus came up easily. He did the breathing exercises and gentle movements. 15 minutes after waking up, for the first time in 6 years, Harold could breathe comfortably. The chest tightness was gone. He could take full, deep breaths without restriction. He felt like a different person. Harold has now done this ritual every single morning for over a year. He says those 15 minutes saved his breathing and his quality of life. He starts every day breathing comfortably instead of suffering, and this has transformed everything from his mood to his activity level to his willingness to make plans. The key to success with this ritual is unwavering consistency. You must do it every single morning without exception. Skipping even one day means starting that day with the same morning suffering you're trying to eliminate. Think of it like taking essential medication. You wouldn't skip that, so don't skip this ritual that works better than most medications for morning chest tightness. Some people enhance the ritual with additional elements. Adding prayer or meditation during the breathing exercises for spiritual dimension. Playing calming music during the sequence. Doing it outside for fresh air exposure if weather permits. These enhancements are fine as long as they don't interfere with the core components and timing. Respiratory therapists who work with patients with chronic breathing problems teach variations of these techniques as standard care. Research on mucus clearance documents that the combination of hydration, steam, postural drainage, and controlled coughing is far more effective than any single intervention. Studies on breathing exercises show they reduce breathlessness and improve respiratory function. Clinical observation consistently shows that morning is the critical time for respiratory interventions, and establishing good morning practices determines breathing quality for the entire day. The insider knowledge that specialists share is that this type of morning ritual can provide more symptom relief than medications for many people, yet it's rarely taught outside of specialized rehabilitation settings. Patients struggle unnecessarily because nobody showed them this comprehensive approach. Here's something remarkable. Research comparing morning respiratory symptoms in people who do comprehensive morning rituals versus those who don't found that the ritual group had 70 to 80% less breathlessness and chest tightness throughout the entire day, not just in the morning. The morning intervention created a cascade of better breathing that lasted for hours. The revelation is that you might not need more medications. You might need a proper morning ritual that addresses the actual causes of your symptoms. When you do this ritual and experience chest tightness dissolving within 15 minutes, the psychological impact is profound. Mornings transform from frightening to empowering. You feel in control instead of victimized. Confidence replaces fear. Energy and mood improve because you start every day breathing comfortably. Quality of life transforms when breathing stops being a constant morning struggle. We've covered the complete morning ritual that seniors swear saved their breathing. Immediate warm lemon water hydration. 5 minutes steam inhalation. 5 minutes postural drainage. Controlled coughing. 3 minutes breathing exercises. 2 minutes gentle movement. 15 minutes total transforming chest tightness to comfortable breathing. The question is whether you're going to do this ritual tomorrow morning or continue suffering. Set up tonight. Prepare your water, bowl, pillows. Tomorrow morning, do the complete 15-minute sequence. Notice how you feel after. This could be the morning your breathing transforms. Begin tomorrow. Your lungs are waiting for the comprehensive support this ritual provides.